Ofloxacin 0.3% ear drops are used to treat outer ear infections, also known as swimmer's ear, and middle ear infections. These drops work by stopping the growth of bacteria in the ear. It's important to note that ofloxacin only treats bacterial ear infections, so it won't be effective for other types of ear infections. It's also crucial to use this medication only as prescribed, as unnecessary use or overuse of any antibiotic can lead to decreased effectiveness. The recommended dosage and optimal timing for using ofloxacin ear drops can vary depending on the individual's condition, so it's important to follow your healthcare provider's instructions carefully. Before using ofloxacin ear drops, be sure to read the patient information leaflet from your pharmacist. If you have any questions, ask your doctor or pharmacist. To apply the ear drops, make sure to wash your hands first, and try to have another person give you the drops if possible to avoid contamination. Hold the container in your hand for a few minutes to warm it, which will minimize dizziness. Lie on your side or tilt the affected ear upward, then place the dropper directly over your ear and administer the prescribed number of drops. If you are using single-use containers, empty the contents into your ear. For outer ear infections, adults should hold the earlobe up and back, while children should hold the earlobe down and back. For middle ear infections, gently press down several times on the cartilage that partially covers your ear opening to allow the drops to enter. Keep your head tilted for about 5 minutes, or insert a soft cotton plug if directed. Repeat the above steps for your other ear if necessary. Use this medication regularly at the same time each day to get the most benefit from it. Continue to use this medication for the full time prescribed, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your condition does not improve in 1 week, inform your doctor. Also, report any ear discharge that occurs after the treatment period is completed. Remember not to use this medication in the eye. If you experience mild irritation or discomfort in your ear, dizziness, headache, earache, or changes in taste while using ofloxacin 0.3% ear drops, it's important to let your doctor or pharmacist know. Your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects, but it's important to tell your doctor if you notice any tingling, numbness, or changes in hearing. Using this medication for a long time or repeatedly may lead to a new fungal ear infection, so be sure to use it only as prescribed. If you notice new or worsening symptoms, contact your doctor. While it's rare, a serious allergic reaction to this drug is possible. Seek medical help right away if you experience symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to talk to your doctor or pharmacist. If you have any concerns about side effects, don't hesitate to reach out to your healthcare provider. Before using ofloxacin ear drops, it's important to let your doctor or pharmacist know if you have any allergies, especially to other quinolone antibiotics. This medication may contain inactive ingredients that could cause allergic reactions, so it's best to talk to your pharmacist for more details. If you have a history of other ear problems or have had 2 or more ear infections within 6 months, it's important to inform your doctor or pharmacist before using this medication. Ofloxacin ear drops may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid activities that require alertness, and to limit alcoholic beverages while using this medication. If you are using marijuana, it's best to talk to your doctor about it. If you are pregnant, it's important to discuss with your doctor whether the benefits of using this medication outweigh the potential risks. If you are breastfeeding, it's best to consult your doctor before using this medication, as it is not known if it passes into breast milk. When using ofloxacin 0.3% ear drops, it is important to be aware of any potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of ofloxacin 0.3% ear drops. If someone has taken too much of this medication and is experiencing severe symptoms like losing consciousness or having trouble breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can contact your local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center. It's essential to remember that this medication can be harmful if ingested. Remember, Ofloxacin 0.3% ear drops are prescribed specifically for your current condition and should not be used for any other infection unless directed by your doctor. It's crucial to keep the infected ears clean and dry. Try to avoid getting the infected ears wet when bathing and refrain from swimming unless instructed by your doctor. If you happen to forget a dose, just use it as soon as you remember. But if it's almost time for your next dose, just skip the missed one. Don't take double the dose to make up for it. Just stick to your regular schedule. When it comes to using Ofloxacin 0.3% ear drops, it's important to store them at room temperature and away from light to maintain their effectiveness. Remember to keep all medications out of reach of children and pets to prevent any accidents. When it comes to disposal, it's important not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. It's always a good idea to consult your pharmacist or local waste disposal company for guidance on the best way to dispose of medications. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.